another one. Then the Italian story is the most dramatic. There's a hospital in Italy, in the area hardest hit by COVID-19, which takes care of Kawasaki children. So for 5 years preceding February 17th, 2020, they found out they had only had 9 cases of Kawasaki. Then between February 17th to mid-April, they counted their Kawasaki cases. There were 19, which translates to a 30-fold increase in Kawasaki syndrome. It turned out that all these 19 children were positive for SARS-CoV-2. Same for New York, where as we speak, 102 children have tested positive for COVID-19 and Kawasaki disease. France has also reported 135 cases, with 2 of them with 1 child dead. Same for Michigan, where 3 children are of COVID-19 and also have Kawasaki syndrome. What does this mean? The thief has been caught. For the first time in history, the world is able to syndrome, first observed in 1961, is due to an infection, or at least associated with an infection. This is history making. Kawasaki disease has been caught with an infection. That's what it means. Secondly, which areas does Kawasaki disease occur? I printed this graph for you to see. It shows you how the disease is mostly found in Japan, where there's an incidence of 264 per 100,000 children. Korea, Taiwan, Singapore, you can see it for yourself in that order. So where is Africa in all this? I did a literature search. There's been 1 case report from the pediatricians in Ghana in 2015. Then, sometime in 2015, Nigerian physicians reported 8 cases. But here's what they noticed. Maybe it's just been underreported. Even in African Americans in the United States, because of the color of their skin, it's hard for physicians to pick up the red rash, and so it remains undiagnosed. Here are the implications for you watching. Number 1, doctors need to be aware that if a child is presenting with these Kawasaki syndrome, test them for COVID-19. The case definition issued by the CDC has 3 criteria. Number 1, any child below the age of 21 presenting with a fever of more than 38 degrees, also has the full with red eyes, swollen hands, cardiovascular abnormalities, respiratory difficulties, neurological disease, rash, hematological disease. Think of Kawasaki, especially if there's no other proven cause, and also if they have abnormal inflammatory markers. And I'll share these inflammatory markers with you. I've labeled them A to about H. A for low albumin, B for bandemia and neutrophilia, C for C-reactive protein, and cardiac markers or CPK, actually 1D dimer, elevated SED rate, F for ferritin, fibrinogen, L for LDH, I for interleukin 6. Well, how is Kawasaki disease treated? Initially, there was no treatment, and then studies found that if you give the children high-dose intravenous immunoglobulin, you reduce the rate of long-term heart disease from 30% to 3%. That's pretty impressive, right? Actually, a lot of the children who presented earlier were given this IVIG. It acts quick. The fever resolves and the symptoms improve. Inflammatory markers go down. This has implications. If COVID-19's expression in children can be treated with IVIG, what about adults? IVIG is pooled antibodies from many sources, which originally was intended to treat people with low antibody levels or primary immunodeficiency. And then guess what? We found it works for myasthenia gravis, multiple sclerosis, lupus, dermatological conditions, bullous pemphigoid. They all have something in common. Idiopathic children's illness give us a clue as to how to manage COVID-19. I'm in no way suggesting that everybody with COVID-19 should get IVIG. It's just food for thought. If IVIG works with these hyperinflammatory syndrome in children, and we know that COVID-19 causes this hyperinflammatory syndrome, is it possible that IVIG would work? Just a food for thought. So 3 things I want you to take from this video. Number 1, red eyes, beefy red tongue, swollen lymph nodes, red rash on the body, and puffy red fingers. That is as simplistic as it gets, but there's a wide variety. That ultimately, said and done, when children recover, found what is called the coronary arteries, which are supposed to be supplying blood to the heart, and it also causes myocarditis or inflammation of